Good morning, I'm Vic Senese, and this is UroNurse News. Today we're looking at breaking research that shows hypertension may harm the brain far earlier than we ever realized, even before blood pressure rises. A new preclinical study from Weill Cornell Medicine, published November 14th in Neuron, reveals that high blood pressure impacts blood vessels, neurons, and white matter days before hypertension becomes measurable. These early changes may explain why patients with hypertension have a 1.2 to 1.5-fold increased risk of developing cognitive disorders, including vascular cognitive impairment and Alzheimer's disease. Now, you can take a look at that study there. On the left, you see normal endothelial cells in a mouse cortex. In the middle, after the hormone angiotensin induces hypertension, large clusters of sentient aging endothelial cells appear in blue. And then on the right, after blocking angiotensin receptors, these cells are largely rescued. This visual tells a powerful story. Hypertension begins damaging brain cells long before the blood pressure cuff can pick it up. The researchers induced hypertension in mice using angiotensin, a hormone that raises blood pressure. Then they looked at the brain. At 3 days before any measurable rise in blood pressure, and then again at 42 days when hypertension and cognitive decline were both present. Now, what they found was absolutely remarkable. At day 3, 3 major brain cell types already showed major gene expression changes. Endothelial cells, the cell linings of the blood vessels, showed premature aging, reduced energy metabolism, sentience, meaning they stopped dividing, and early weakening of the blood-brain barrier. Now, the blood-brain barrier is essential. When it weakens, harmful molecules get in and nutrients stay out. Intraneurons, the regulators of brain signaling, showed early damage, produced an imbalance between inhibitory and excitatory signals. This imbalance is also seen in Alzheimer's disease. Now, oligodendrocytes, the cells that maintain myelin, fail to activate genes needed for repair, led to impaired communication between the neurons. Without healthy myelin, cognitive function declines. So by day 42, these early molecular disturbances match clear cognitive decline in mice. Senior author Dr. Castino Ledoccola explains it clearly. We found that major cells responsible for cognitive impairment were affected 3 days after inducing hypertension, before the blood pressure increased. That's the key, before you could have picked it up on a blood pressure cuff. Do something other than elevated pressure. Something other than elevated pressure is driving the earliest damage. Now, losartan, an angiotensin receptor blocker already used for hypertension, showed impressive results. The drug reversed early endothelial cell aging, restored intraneuron function, protected the brain independent of lowering blood pressure. Now, this may explain why some human studies suggest that angiotensin receptor blockers could be more protective for brain health than other blood pressure medications. Researchers are now trying to understand how prematurely aging blood vessels damage brain circuits, how to repair those oligodendrocytes, and intraneuron function, whether early treatment can prevent cognitive decline in humans. Their ultimate goal, medications that not only control blood pressure, but truly protect the brain. All right, get ready for tomorrow's UroNurse News. I will dive into why open conversations about sexuality can make a real difference in cancer recovery. From practical tips to expert insights, we're breaking the silence and empowering survivors to reclaim intimacy and wellness. Don't miss it. Your journey to healing includes talking about what matters most. Hypertension is still one of the most common medical conditions worldwide. And this study reminds us that the brain may be more vulnerable long before symptoms appear. As always, stay informed, stay proactive, take care of your health, and, like us and subscribe. I'm Vic Senese, and this is UroNurse News.
Updates on clinics, tips that are new, stories of nurses